the province. So I mentioned the notion about evaluation, so that's what that slide is about. And now it gives me great pleasure to introduce you to our speaker today. And this is our dear Catherine Newstead, has worked as a vocational rehabilitation counsellor implementing the IPS model of employment for over 10 years. She's worked specifically with adults aged 18 to 64 dealing with mental illness. Catherine is a member of the Canadian College of Vocational Rehabilitation Professionals, pardon me, and a graduate of the Community Rehabilitation Program at the University of Calgary. She has mentored and trained staff in the IPS model for advocating and presenting at various psychosocial rehabilitation conferences. And I think many of you in the room know Catherine and know the kind of quality in education that we're going to get this morning. So we're so grateful to have Catherine. A warm welcome to you. So I'm just going to pass you over to Catherine right now.
Well, good morning, everyone. I am in touch with you from Honolulu at the moment, having a wee holiday here. It's very beautiful. And I'm very excited to be invited by Regina, Casey, and Douglas College and the Psychosocial Rehab community in BC, and also the Ministry of Supported Education to help me along with this. To help you. The IPS supported employment model is one that some of you may be familiar with and some are not. Matt, am I going to the next? There we go. Thank you. So the IPS model, if you think about all the sessions that you've already attended or courses that you may have done, and you think about supported employment with the folks that we support, people with mental illness, often drug addiction and other issues, it's a very broad plane and it can take many forms. Imagine it as a very large ship. And if we look at the IPS model, it's very, very specific. It's probably more a bit like a sailboat. You're making it a narrow and depth, not narrow in philosophy, but has depth in terms of the focus that we work on. So it helps people with serious mental illness work at regular jobs, those that any one of us might apply for, and it is their jobs of their choosing. And there are many models of supported employment, but ours is, sorry, not ours, the IPS model probably has the most evidence-based research behind it. I've given you a website there from Dartmouth in New Hampshire. We do, or at least the Vancouver Coastal Health and the Fraser Health use this particular model of IPS to keep us on the straight and narrow, if you will. And the definition that you see there comes from Gary Bond. The next one there, Matt.
Just gonna want to use the arrows at the bottom of your screen there, Catherine.
Oh, at the bottom of, okay, I was looking at the top. So I really like this particular quote. I have it on my door all the time. Readiness often occurs only in retrospect after people have done something successfully. So waiting until a person with mental illness is ready to move on can often be stagnating and disempowering. Often people have to experience success before they believe they can be successful. And this is something that I think all of us can happen to us. We often think about we have to be ready for the next step, and of course that is true, but sometimes we just have to jump in and see what will happen in order to have the experience. And in the IPS model, we do everything in tandem, and I'll talk about that a little bit more in a moment. So what makes this particular model of supported employment different from other ones? First of all, the person who is delivering IPS services, the IPS worker, sometimes we call them vocational rehab counselors, sometimes we call them vocational specialists. We are integrated with clinical services, so we're working alongside those individuals who are physicians, those people who are case managers, social workers, occupational therapists, recreation therapists, healthcare workers, nurses, and others. So at any given time, at any given day, we could be having conversations in formal ways and in informal ways, as anybody else would in that team. The second thing that makes it unique is that our job search is rapid. In other words, literally from the moment that you're meeting someone, probably within a month, and if it's longer, something isn't going quite right, you are actually having that person, hopefully, actually having interviews for jobs. So the same time that you're helping someone prepare for an interview, putting together their resume, teaching people how to do their own job search as well as assisting them with job search. And job marketing is something that I'll talk about a little bit more later. How to conduct myself socially at work. All of those things happen at the same time as you're actually applying for work, looking for work, and getting out there. And the individual preferences are primary. So, for example, if someone says, I want to be a teacher, I want to be a high school teacher, and they don't have the credentials to be a high school teacher, you take that seriously and you walk through what are the things that you need to do in order to be a high school teacher. And if you wanted to be a high school teacher, what are the things that you might need to do in order to do that? And if you decide you don't want to do that, what would be your plan B? I think sometimes people may have experienced the situation of not being taken seriously. And in this program, the whole idea is this is your job, this is your life. What can we do to make you reach forward vocationally? So that's why the individual preferences are primary. And that's part of the research. And again, I will talk about that more later on. There's a strong belief that pre-employment training does not necessarily dictate readiness or ability to work. And we've seen this a lot. Sometimes people come in, they may be still having difficulties with medication, or they may be not feeling completely settled, and yet they're able to work, and sometimes working actually helps to get people settled. And their preferences are primary. The other thing is we do not exclude people. For example, in some programs, if a person has not worked Okay. All right. So within the IPS model, when we look at the research over the last 15 years or so, particularly in one that was done by Dr. Marc Corbier in 2009. They did a pan-Canadian research program that lasted 10 years. And these were the four things that really indicated what made the ability for people to work possible or helped with our numbers. And by the way, overall, if you look at the American model, it is probably around 42%. In Vancouver, I'm not sure about Fraser Health, but in Vancouver we're sitting at about 52%, which for this particular population is pretty good, but that means there's another 50% of people that are not. And that's for a host of reasons, and we can talk about those at another time. So you can see there the integration with a mental health team makes a huge difference. The zero exclusion based on any reason a person may want to look for work. We don't exclude people. The goal is for competitive employment. There are things that are very important, such as volunteering, pre-training, working in a sheltered situation perhaps, or in a clubhouse. Those are all honorable, good things. And the goal of this program is about competitive employment, people having full citizenship in their community. And the fourth thing is probably the most important, and that is rapid job search, looking for work right away. We did a paper in 2009, and I can tell you more about that if you like. And we did a case study of an individual who had been wanting to work, stated he wanted to work for over 20 years. He had gone to every employment supported program you can think of over that 20 years, but he actually didn't sustain paid employment. When we helped him within the IPS program, he started working, and that's been 2009. He's still working. He works as a server. He works in special events where he's serving food, alcohol, helping with putting together packages for people who are involved in a conference, for example, all those kinds of things. And the reason I think that worked for him is because we did things like, I'd say to him, let's say his name is John, John, if you could start work tomorrow in a job of your choice, and you had to be there at 9 o'clock in the morning, would you go? So the answer is yes, no, or I'm not sure. So as an IPS worker, counselor, that gives you a starting point of where you go next with that individual. And in his case, it was, yes, I would go, and I want to be a server. I want to work in customer service. So what it is not, IPS supported employment, what is it? It is not. It is not pre-vocational training. It's not doing a work experience placement. It's not preparing work with group sessions, for example, dealing with stress management, or how do I interact with people at work. It's not about volunteering or practicums. Are those honorable things? Of course they are honorable things. But in the IPS model, we are not focusing on those things. And for those individuals who are working competitively, that seems to be a big issue, is being able to get out there soon. The hope of work, the desire to work, is a really big issue for a lot of people. Getting to the hope, reaching your goal of competitive employment can be really scary. Just think about all of us and what is expected of us in our work day to day. It's not easy. So sometimes a lot of the work we do is around helping that person go to their first day, second day, weeks, months, and so forth. It's not easy going to work, but it does mean being part of life. So the other thing that it is not based on the length of time away from the workforce. I just gave you an example of someone who hadn't been working for over 20 years. If you look at some of the work done by WorkSafe BC, you'll often see that those individuals who've had an injury of some kind, if they don't go back to work within about 2 years, the stats decline rapidly. So what is important to think about within this model is that, again, does not necessarily exclude people from actually going back to work successfully. And the last thing I've got there, individuals are not necessarily symptom-free to work successfully. And this is something that I've had to learn, and my clients, the people I support, teach me every single day. And your clients are your best teachers, by the way. So, for example, you have an individual, I worked with someone who always had certain delusions about certain situations around his family. But he worked, and he worked very hard. He was very good at what he did. He did a lot of landscaping. He was very accomplished at his work. And he did have symptoms of mental illness. He had you know, negative and positive symptoms of schizophrenia, but it didn't mean that he couldn't work. Now, that being said, someone is dealing with a severe depression, for example, they may not be able to work, or it may be that work is the thing that helps them improve, and that's a very individual thing. On the other hand, if someone's dealing with mania, let's say, that makes it very difficult to work. But it's important to stay neutral about what might be and believe that if this person wants to work, that you help them along. So again, while supported employment services can be offered in many situations, and they are and do very well in clubhouses and other situations all across Canada and around the world, actually, the IPS model is always within a community mental health team. Now, what that means is that those individuals who come to a mental health team are eligible for services, and they're generally people who have more serious symptoms that make it difficult for them to get on with their life. That being said, there is talk about offering IPS those individuals who may not necessarily need the use of a mental health team, and that's something that research will have to deal with in the future, because right now that is how it is one of the tenets of how people are successful in working. So in other words, it's not the only type of supported employment out there, but it's the most rigorously researched so far. And as I mentioned, I think earlier, it does not include programming such as group work. And I must say, it isn't that these things aren't important, but for someone coming into the IPS program, it's not what our focus is. And when I said saleship earlier in the presentation, that's what I really mean. It's going very focused down a path.
Right, Catherine, I'm just wondering if you can respond to Doug's question down below there regarding definitions of community mental health teams.
Okay. Where's Doug coming from? Where does he live? Victoria. Okay, so in Vancouver, a community mental health team is one of, how many do we have, Regina? I think 7. And if a person goes, let's say, to hospital and is diagnosed with a mental illness, a serious mental illness, they may be referred to a mental health team, a community mental health team, for ongoing case management and to see a physician, sometimes every 2 weeks, once a month, or every 3 months, depending on the individual and what they need. So the community mental health team is one that has those clinical staff that I was mentioning earlier, physicians, nurses, social workers, healthcare workers, and other rehab staff such as healthcare workers, peer support specialists, certainly recreation therapists and occupational therapists, and they may receive services that are other rehab oriented as well. Does that help? Okay. Thank you for asking that question, Doug, and please feel free to ask me questions as we go. We can also make sure we have time for questions at the end. So if you're not getting a chance to ask a question and you have something burning, please make a note of it, and I'll do my very, very best to answer it to you later on. Okay, so job marketing. Within the IPS model, job marketing is a big part of what we do, and IPS workers, vocational rehab counselors, are out and about in the community quite a bit, making connections with potential employers or actual employers. And that's a big part of our job. And I think people probably have heard those terms, job developer, job marketer, and so forth. Now, of course, what that means is that the individual we're supporting has to deal with at least some level of disclosure to tell someone that they have a mental illness or some kind of health issue that makes it such that they may need accommodations in the workplace. That might be working a slightly different schedule, coming in later, leaving earlier, part-time hours as opposed to full-time hours. It might mean needing a quieter space to do their work. It can mean all kinds of different things. Now, of course, a lot of the people that we work with, or this is my experience, others may feel that is people, they don't want people knowing that they have a mental illness. It's none of their business. In the States, there is the Act, the Persons with Disability Act, that makes it, there's a very powerful legal legislation that makes it such that employers are required by law to hire people with mental illness. In Canada, we don't have something quite like that. But at the same time, we respect people's wishes. Someone says, I don't want people knowing that I have a mental illness. I don't want them to know about my personal issues. I wouldn't be asking them about theirs. So it is really something that the individual you're supporting has to decide, and it's your job as the IPS worker to help them with that. Sometimes what happens in the beginning is there is no disclosure whatsoever, and then later on there may be disclosure for a variety of reasons. And as I mentioned there's fear of external stigma. There's also internal stigma, and people are worried they'll be treated differently. And this is a really specialized area of the work we do. It's specialized because it's something we have to revisit over and over again, may or may not. And so as an IPS counselor, you may be working with an individual. Is there something that you want to say specifically to the supervisor that is just about one little thing? I'll give you an example. I work with a gentleman who was hired at a company where they made power grids. And when we got there, I had made the connection with the employer. I said, I am an IPS counselor. I work with people for the Canadian Mental Health Association. And so he didn't ask me further questions at that time, but when we got there, the individual I was supporting, the supervisor said, is there anything that I need to be aware of that would be helpful? Very nice gentleman. The client, or the person I was supporting, said, once in a while, I'll need to go and get a drink of water and maybe go outside and get a bit of fresh air. And the supervisor said, cool, I'm fine with that. When you need to do that, go ahead and do it. And he was very good at his job. It was a very technical job. I had no idea what he was doing, but he sure did. And it worked really well. So again, it's very individual. There are things that we do have to pay attention to probably in any supported employment program, but certainly within this specialty, these are things that we deal with all the time. I would be really interested to hear in people having to deal with criminal record checks. I've worked with people who went to volunteer and their criminal record check comes back positive. In other words, they have a criminal record. And in fact, they don't have a criminal record, but perhaps they've been taken to hospital under the Mental Health Act, and so the police were involved. And very sadly, tragically, those individuals are, that's held against them, which is awful. However, there is a lot of work, a lot of advocacy work going into this particular area in order to make sure those kind of things don't happen anymore. They still do occur. And I'm not sure how it is in other parts of the province and other provinces across Canada, but it is most definitely an issue. I did have worked with a young woman who had gone to hospital, had called 911. She was feeling suicidal. The police intervened. They took her to hospital. She was treated. She went to community mental health team for support, and about 5 or 6 months after that, she decided to go to BCIT and take an accounting program. She successfully completed that full-time, which is no small thing. And she applied to a nonprofit organization, which is what I helped her do. She did the criminal record check. It came back positive. And I asked her if she would like me to intervene on her behalf because she did not have a criminal record. But she was so embarrassed and felt so ashamed of her situation. So again, we're talking about that internal stigma, not just external stigma. And she didn't get that job. For that reason, she didn't want to go forth, and I respect that. The good news is that she went on to work in another position and has been with that organization, I believe, for about 3 years now, which is wonderful. But it is something that all of us in this work have to pay attention to. Special considerations, nicotine. I'm not sure how it is in other provinces. If there is no union in place, if a person has not disclosed and they're working their regular hours, I believe according to the BC labor laws, an individual can be asked to work a total of 5 hours before they have a break. So for example, if you're working at Superstore, Canadian Superstore, in the produce section, and you're there after 5 hours, they have to give you 1/2 hour lunch break. Now for someone who smokes, and a lot of the folks that we see often do smoke, although that's declining, and there's a lot of really good work in this particular area. The nicotine, people go into nicotine withdrawal. So sometimes it's really helpful for the IPS person to work alongside with the case manager, perhaps the occupational therapist or other people working with the smoking cessation part, so that the individual isn't challenged by symptoms of nicotine withdrawal. And so that may be using a patch or gum. And sometimes we do ask for accommodations so that person can take a smoke. But that is an issue for sure. And I'm sure others of you have dealt with this as well. Harm reduction in regards to substance abuse. Again, I'll work with an example. I worked with a young gentleman with a young family who wanted to work in any kind of construction, janitorial job. He had quite a bit of experience in that area, but he used crystal meth from time to time. And a lot of those industries, drug testing is really common. So it made it very, very difficult for him to actually work successfully in that way. And so again, working with his other caregivers, family was a big part of his support system, and helping him with that so that he could work. He really felt strongly about wanting to support his family at the same time dealing with that addiction. So it was something he had to work through a lot and had received a lot of support to make that work. The involvement of family and significant others, I can't say enough about that. When I worked in the downtown east side, a lot of people are very estranged from their families and do not have friends or very superficial friends. And that can be a big part of an individual's support, and you can involve them with the IPS program as they might with the mental health team. And certainly in the early psychosis intervention programs, family is a huge thing. You're often working with parents, siblings, husband, wives, and so forth. The fifth thing there, Canada versus USA Persons with a Disability Act. Thank you, Gisela. I just see you've put something there about criminal record checks. Thank you very much. That would be very helpful. So as I mentioned earlier, in the States, there's a very powerful act, legal legislation, And in Canada, we don't have anything quite like that. So it does make a difference. As people that implement this program, we are required to follow the Fidelity, the things that make successfully working in a competitive job real. So that can be a challenge. What I've got for you here is a case study, because what we do is very strength-based. Here's Jeffrey. He's 37 years old. I'm giving you a case study of similar to someone that I worked with. He's Chinese. He's Chinese-Canadian. English is a second language. Lives with his mother and his wife. They're expecting a baby. He does attend the mental health team monthly. He last worked 9 months ago at a breakfast cook, and he'd worked there for a year and a half. He really enjoyed the work, but he left the position because he was, quote, feeling dizzy all the time. And when the nurse and when the doctor talked to him about that quite a bit, that was as far as we could get to what that is, feeling dizzy, which we thought could be with medication, could be to do with anxiety and so forth. But it really got in the way to the point where he actually left the position. Now he's feeling well. He wants to go back to work. He is well qualified to do that same work, and that's his area of choice. How would you go about assisting Jeffrey to find employment from a strength-based point of view? So Matt, I'm not quite sure how this works from here. What will we do?
So maybe we'll just give folks a few minutes to think about it and then type in their responses. I'm very interested to see what folks think about the best approach here. And maybe while we're waiting for that, we had a question from Lois just a tad back regarding sort of coming out of the criminal records conversation. But what about folks who have criminal records for minor criminal charges? So folks who've been in contact with criminal justice system or forensics and of course still need work as part of a recovery process as well. Do you have some suggestions around that?
Good question, Lois. Thank you for asking that. I'm sorry I didn't put that in there because that is not uncommon for people. We are working with people in the forensic system or people who have criminal records. There are a number of things. It really depends on the kind of work that the individual is applying for. So more and more employers do require people to have a criminal record check, even when it would seem that that isn't necessarily needed for the work itself, but it's becoming more and more common. So what seems to work from my point of view, or the people that I have worked with in this system, is to be upfront with the employer to say, this is what happened to me at this time, and I'm well, I'm ready to work, I'm here, what, can we work with this? And that is seems to have been the best way we can work around it. The other issue, we've had people that have had pardons, although that's pretty iffy. When they get a pardon, there's so much legislation around that. It can take a very, very long time to do that, and of course it costs money to do that as well. And even if you have had a pardon, it may still come up. You may have seen that happen. The other thing that we have done is, I'll give an example where someone may apply for work that does not require a criminal record check. And I don't know if that really answers your question very well, but that are some of the things that we have done. Have you had any success in that area, Lois?
So just see a few people are typing. We'll give folks just a couple more minutes to get some thoughts in. It's nice that everybody's got something to say.
Wonderful. Yeah, I mean, someone who's marijuana use, for example, being, may not seem like a big deal, and it's, of course, now it's very different in BC, versus assaulting someone is very different again. And even though the individual may be well, it is, criminal record checks are definitely a big issue. I noticed that Gisela put information on there to help out with that. Okay, so I'm seeing what hopes, creating a resume to summarize his strengths and experiences, highlighting his work focus and his ideal work environment. Yep. Since this individual has a mental health issue, you're looking at doing assessment to determine what types of job would best suited for him. Okay. Physical causes, okay. Okay, he's motivated, he has financial needs, his prior work experience, to explore what he likes to do and how to accommodate his dizziness. Okay, IPS is included in forensic outreach. Thank you, Lois. So from in talking about doing a formal assessment, in the IPS program, that's one area that we don't focus on, interestingly enough. If you were working with an occupational therapist, a formal assessment may very well be done, or some other vocational rehab specialists. In the IPS model, we don't use specialized assessment tools or formal tools, although we're assessing what's going on all the time. And that's an interesting one. Okay. Not sure if I can go back on this. I don't think I can go backwards to see what other points people have made. Matt, could you read out some of them?
Click and drag the little the scroll bar on the right hand side there.
Oh, okay, thank you. Okay. So okay. Thank you, everyone, for giving me so much information here. Okay. So Nona's has a really important comment. She's talking about, are there any physical causes for his dizziness, such as his blood pressure and being adequately hydrated? And I thank you for bringing that up, Nona. That definitely can be an issue at times. I remember working with a young woman whose symptoms of psychosis would come forth when she would get a urinary tract infection, and she was fine when that was treated. So that's a very, very important consideration. Thank you for bringing that up. Okay, it is a major obstacle that invokes hopelessness. Oh, sorry, that's in regards to the criminal record check. Yes, you're quite right, Lois. I think that's something we really need to work on. You know what, Regina, maybe that's something we could, in our committee that's working on the conference, that is something we could have a longer discussion about and maybe put something forward. Just a thought.
Thanks for that great suggestion. I'll certainly bring it forward to the committee, and should we not be able to do it for the conference, we may be well able to do a webinar on it. So I absolutely hear you. It actually was on our list, so thank you very much for that affirmation. Thank you.
Yeah, thank you, Lois. Hopelessness is a really awful thing. Working as a breakfast cook may have him waking up too early in the morning, or it may be too soon after taking his meds. True enough. And that's a good thing to think about. Yes, Absolutely. I did work with an individual, not the same person, but someone who had to be up at 4:30 in the morning to start his shift at 6. And yes, he had to change taking his medication earlier in the evening in order to be able to manage that, and that's a really good thing. So that's really asking someone to be adaptable, to be flexible in order to make this work. And again, this really, Erica's comment really speaks to why it is so important, or why it works well to actually be working an integrated team alongside other folks who are looking at those clinical things as well. Okay, and Terry said that has been a barrier to finding work for some. So glad to hear it is eradicated. We're back to the criminal record check, and yes, I'd like to see more. And Gisela is talking first. I would like to explore what Jeffrey's hopes are in terms of work. True enough. What is it that he really wants? What does he want out of his particular job? And Liz has talked about work with him to create a resume summarizing his strengths and experiences. And let's see, what he especially likes about his work focus on what his ideal work environment looks like. What does that situation look like? To get a sense of what types of businesses to target. That's really helpful too. You can see how much thinking this involves. Thank you, Liz, for that. So Liz is trying to think about, she's trying to idealize what is it that work environment has to be. What does it look like? What does it smell like? What does it feel like? Who are the people there that would make it right or helpful? And Samantha's mentioned, since this person has a mental health issue, can you look into thorough psychological vocational assessment to determine what types of job would best be suited for him? And this is done in other vocational rehab situations all the time, and it's certainly done in other supported employment programs. Within the IPS model, Samantha, we don't look at that particular formal assessment, as I mentioned a bit earlier. Again, it doesn't mean that that isn't important, but what it means is that the job is what he believes he wants. If he's asking for exploration for what jobs would best suit him, then that's something that another program could help him with. But if he says he wants to be a breakfast cook again, then that's what we would work with and try and help him go through that. I can't emphasize enough that we can't say that this is the only way of doing things, but this is the IPS way of doing things. Let's see. Okay, we have more people. From Nona, for Jeffrey, I would try to find out, okay, again, someone's mentioned the physical aspects. Thank you for that, Nona. Very, very important. And sometimes it does get lost. I'm going to give you an example of an individual who said that he wanted to be a security guard. Now, most of you, all of you probably know that to be a security guard, you have to have formal training and you have to have a certification to be a security guard, at least in BC you do. And you have to get a government-issued certification in order to do that. Now, this person was working with staff who said, we don't believe that working as a security guard is the best for you because it would mean working odd shifts. It would mean maybe working at night, which doesn't go along with your medications and so forth. And those things could very well be true, but he kept saying, I want to be a security guard. What was interesting about that is they helped him get a job working, I think, in customer service. I can't remember the type of work, but it was retail. And what happened was he earned enough money. His plan was to take the security guard training. And he did that. He took the level 1 and the level 2 that's required in BC. He completed it successfully. He sent the information as was required by the educator, the education agency, and he did disclose that he had a mental illness. He got his certification as a security guard, and he now works as a security guard. So I guess what's important is to be as open as possible when it comes to what their preferences are. And it happens all the time where I may think, I don't know that that's a very good choice. In my mind, I can't imagine why that person has picked that. But it's really working with that individual's process. Okay, so from Matthew's put, from Erica, working as a breakfast cook may have him waking up too early. Yes. In the morning, or it may be too soon after taking his AM meds. Yes, we did talk about that. He may not struggle with the dizziness later on in the day. Very true. And then, of course, we have Selena here. We've mentioned before. He's motivated. He has financial needs, etc. And how is it we can accommodate his dizziness? And actually, what we did with Jeff, he did get another job as a breakfast cook. The job was such that he could work 5-hour shifts. I think he worked from 6 to 11 every morning, but it was Monday to Friday, which of course is unusual in that industry. But he was working in an office building where people were coming to the cafeteria and the restaurant just Monday to Friday. And that worked for him. And as long as he had a chance to recoup, and that seemed to help. I think it's really not clear what the dizziness was about. Could be all of the things that we've mentioned. But his confidence did improve. And I'm happy to say that his child, his daughter, is now 3 years old. And he's very happy to be a dad. And still lives with his wife and his elderly mother. So it's good to see. Okay, and Krista's brought up a very interesting comment about cultural challenges, ongoing cultural shock, making sure that the environment is inclusive and perhaps balancing with appropriate social supports. Thank you for that. That's a really interesting thing. What was interesting with Jeffrey is that he said, I want to work for a Canadian. I want to work in a Canadian breakfast place where they serve bacon and eggs. And I'm not sure what that meant. I tried getting behind that comment or that wish, and I think it had to do with he'd had an experience working where he'd been paid under the table, and he didn't want that to happen. He wanted to be paid a regular paycheck with, making sure he gets his CPP and all those kinds of things. And also that kind of food was what he felt most comfortable making. So that was an interesting thing. But, language was a challenge, but he managed to make it work. Erica Steinson, I have valuable and detailed experience working with criminal records. I would be willing to share in a private conversation. Thank you, Erica. That is a really wonderful thing. Regina, we're finding all the talents of everybody on this amazing website, or on this webinar. Okay. And then we have from Candice, certainly exploring what was causing the dizziness in the first place, medication or environment. Yep, environment could be triggering symptoms leading to dizziness, anxiety, or perhaps the environment is too hot. Yes, you know what? I hadn't thought about that, Candice. That's a good, important thing. It does get awfully hot, in which can often cause an uncomfortable physical environment leading to dizziness. I hadn't thought about that, actually. Thank you for bringing that up, because he didn't mention the dizziness happening anywhere else. Seemed very specific to that situation And here's where assumptions really play into the issue. I made an assumption it had to do with anxiety. And Lynn Sally, sorry. I appreciate that IPS is very PSR and in keeping with the principles, empowerment and hope. For those of you that might be interested, there's out of Temple University in Pennsylvania, I believe it is, there's a really good booklet that talks about integration with individuals that we support. And I can't remember the name of the workbook off the top of my head, but it challenges people to think about perhaps in supporting people in our communities who have mental health issues, we've gone too far in providing a milieu where people feel safe and comfortable and non-stigmatized. And so that's a kind of, not an easy thing to say, and can be very provoking, I should say, is a better word, and can make people uncomfortable or for defensive. But it's an interesting read, and I will try my best to find that, and I'll pass it on to Regina if anybody else is interested in reading that. It's quite, it makes you think. Okay. And Liz, so just a question around following the lead of the individual. Often people will say what they think we want to hear or are limited in the options that they think are open to them. I find it helpful to really explore and understand the direction a person has named so that I can fully understand what motivates the individual and don't jump to conclusion. Very, very important. Regina, we've got someone else here who's a great thinker. You're all great thinkers. Liz, thank you for that, Liz. It really does mean a conversation with individuals about what they're doing, why they're motivated by what they have in mind. That term realistic comes up all the time, right? So what is realistic? And again, if you take the lead of the individual you're supporting, that's where you go with it. It may not seem realistic to you, or it may not make any sense to you, but you work through that. You work through that. Okay. Sorry, just making sure that I got everybody's comments here. Thank you. Harminder, hello. I joined a little late. Will I send me? Okay, so Harminder, I think that Matthew and Regina will take care of that. Okay. I think we've done that. We finished with Jeffrey talking about the case study. Thank you so much for all your thoughts. I appreciate. I'm hoping that I have an opportunity to meet some of you, if not all of you, at the conference in June. I get so excited. So these are common questions that come up from not just from the individuals we support, but also from their families and significant others, and also from clinical staff. I haven't worked for a really long time, so I don't know if I can anymore. What should I do? Give yourself, this is something I put together that I put in the lobby for people to read. Give yourself the opportunity to try. People who are successful at getting and keeping jobs are the ones who really want to, even when there are challenges. Don't sell yourself short. So in other words, hang on to your hope, hang on to your dream. Let's see what we can do to make that a reality. Another one, number 2, isn't going back to work stressful? Of course it's stressful, but unemployment is also stressful, and it produces this the opposite of integration sometimes. In fact, some people report that they feel better when they are working. I'll mention a young gentleman that I worked with who said to me after 6 months of working, I was checking in with him about once a month by that time, and he said, you know what, Catherine, I'm busy. I don't really have time for my nurse anymore. Now, that doesn't mean that he didn't come to see his clinical team for support, but his focus shifted, and he had other things on his mind. Number 3, can I expect the employment counselor to have a job waiting for me? No. Job search and job marketing are part of the process, and the employment specialist facilitates that with you. This is something that does happen from time to time, and I believe it comes from other situations where people have had jobs ready to go. For example, in some clubhouse models, they may have a social enterprise, which again is really important part of work. And people may go to that, have the expectation that they can start working within that social enterprise, maybe landscaping, maybe a cafe situation or something similar. Okay. I just have a question here I want to make sure that I don't lose sight of. How do we support individuals in our program without a dedicated job developer position? Good question, Darren. It really depends on what you're looking at is people who are working as your peers. What I would suggest you do, this is just off the top of my head, Darren, but look at having a meeting with the people who are part of your team and see what their combined experiences are, what they see as their strengths in the world of vocational rehab, and see if you can build from there. If you want to work within an IPS model or job development, that does mean looking for very formal supports financially and research to make it happen. I'm not trying to say that it's difficult to get to, but those are some of the realities. And actually, Darren, you made me think about another important piece of the pie here. The people that work in these positions and as employment specialists, it's not like occupational therapy as an example where you have a very formal set of criteria in order to train, educate, and become an occupational therapist, and you belong to a very specific organization in order to practice as an occupational therapist. In job development, employment, vocational rehab, you may or may not have people that have formal designations. And a lot of my co-workers have training that may be more broad. It may be as they may have a degree in social work or a bachelor's of science or a bachelor's of arts, but they have worked in a field where they've done worked with people with mental illness, and so they have background in that area, and they've done some vocational support work. And or we may have people that have connections to the business community and have a marketing background. One of my coworkers is actually doing his master's in business, but this is his area of expertise. Let's see. And so Sharon is asking, could you email one of my staff at Prairie Mountain in Brandon, Manitoba? Okay. We're interested in knowing more about criminal record check as a barrier to employment. Okay, we've hit a hot potato with that comment or that discussion. I'm really happy to see that because it's a very huge issue. So if you want to know more, I've given you that same website to look at to explore more about the IPS model, the research behind it, how it works, and so forth. I've also given you an email address for my colleague Ruth McLennan at the Canadian Mental Health Association at the Vancouver Burnaby branch. Ruth is a program manager that oversees the IPS implementation programs both in Fraser Health and in the Vancouver Coastal Health health authorities. And we've been at it now since 2001, I believe. Before that, CMHA had a sheltered workshop, and they moved from the sheltered workshop situation to IPS. So kind of an extreme at the time, from one to the other. Let's see. Here are my references. You can look at Gary Bond's work. He has written a plethora of books and journal articles, and you'll see, if you Google his name, you'll find lots. The next one, Michael Crane et al., The Contribution of IPS to Recovery from Serious Mental Illness, Work, a Journal of Prevention, Assessment, and Rehabilitation. That's from 2009. That was one that I was involved in, and that's a Canadian journal out of Ontario. And that is one where we used the case study I think I mentioned earlier about the individual who had not worked for 20 years and is now working and has been for quite some time. Joe Moroney, IOPS's conference in Narmada, 2004. He's the one that would say work is stressful, but unemployment is more stressful. And I'm sure many of you know his name. And then Jonathan Oldman et al., a case study of the conversion. Oh, I've made a spelling mistake there, of sheltered employment to evidence-based supported employment in Canada with psychiatric services, 2005. And that's specific to what I just mentioned, going from 2001, prior 2001 with a sheltered workshop to post 2001 going into a IPS model, quite an extreme. Okay. I feel that I've only gone on the surface of so much here, and I wish I could talk with you more about these things. Does anyone have a burning question or information that they want other than what we've mentioned already to be sent later? For example, the criminal record check is a hot topic. And someone, I think someone was, Darren, I think it was, Jeff, talking about job marketer, hiring a job marketer. Does anyone else have any questions?
So there, Ruth, or pardon me, Catherine, also Bonnie and Tim were asking about supporting folks in the IPS process of finding work who are struggling currently with substance use.
Good question. Do you have the ability to work with other staff who are supporting that individual? What's important, I think, is there's a difference between substance abuse and harm reduction. I remember working with a young man who had gone to a program to, I can't remember if it was AA or something similar to that, and it did help, but he still drank. And what he did is he would drink less, and he would do it specific to certain hours in the evening. I think it was something like between 7 o'clock and 9 o'clock at night. He was in a very good supported housing situation, which really helped his substance abuse in keeping things in track. So by the time I would see him, I would deliberately make appointments to meet with him first thing in the morning to see how he was doing, and we could talk about it really openly. It's not something I would avoid. I talked about it quite freely with him. I said, "How's that going with your with alcohol, using any other substances?" So being non-judgmental, but also bringing it up is really important. So it's not something that you can hide. On the other hand, I did, as I mentioned before, the person who was using crystal meth, he did very well for a time with the support of his family and it was in in-house treatment program, and so he was abstinent for quite a long time, maybe up to 10 to 11 months, and then he went back into that use, and unfortunately he lost his job because he was missing shifts, or when he came to work he was not in any shape to manage the type of work was expected of him. Certainly, if someone is working on, you can see why they do drug testing on a construction site. You don't want people who don't have all their wits about them when they're working in high places or where, you know, dangers are everywhere around you. So first of all, I would say first and foremost, it's having that open conversation with that individual about any drug, alcohol use. Having permission from them, written permission, to speak with their clinical supports. They have them. And also maybe having a conversation together with their physician, if you can be part of that meeting, if any family's involved, and so forth. When I mentioned earlier that question about if you were offered a job tomorrow morning at 9 a.m., would you show up if it was a job of your choice? And if someone's using drugs or alcohol, if they can say, I really want that job, and you say, okay, what are the things you need to do in order to show up ready to go and be able to do the work that is expected of you, those issues hopefully will come up. But it may take time. So I'm not sure if I really answered your question, but it is a true issue. I would like to see at the conference or in some other situation, I've seen this in other conferences where people who have used substances and or are using to some degree and are working can talk to what their experiences have been, because really they're the experts of their situation, not me. Any other questions, comments, something I've missed? Any words of wisdom?
Just a little question there from Andrea and Pinay there, Catherine, around additions to the IPS model in terms of extra work.
Sorry, I didn't hear that, Matt. Could you repeat the question?
Absolutely. So just a little further up. Sorry, I got a little bit of trouble with my sound. Andrea asks, are there exceptions in the IPS model where group work or additional assessment is acceptable if it will help a client achieve their goal? I found some additional interventions helpful when a client is getting stuck in reaching their goal. Okay,
very good question. The short answer is no. Those are not included in the IPS model. What we have done is we've referred people back to other staff, for example, an OT, or to a vocational program that does those formalities, because that's not the focus of what we do in IPS. Again, doesn't mean that that's not important or not useful. We all may need those group situations. And we may need some formal assessment. I have been involved in those myself, and they have been helpful. You have to remember that in order to be called an IPS supported employment program, you have to follow the Fidelity. And if you look at the Dartmouth site, that will help you with that further. Yeah, there are people that really want to have those formal assessments, or they're really stuck, and that's helpful. I would like to make a comment. One of the criticisms that IPS receives is that we end up helping people find jobs that are minimum wage. They are in the service industry. They're not jobs they're not careers, they're jobs. And that's something I would like to talk about a bit more. It's been my experience, and I could be wrong, there's no research to follow this. This is just my own observation and theory, is that people, when they come to us, because of when they became ill, they often miss those important developmental stages where we might have a job working, making burgers, or babysitting, or delivering papers, or doing some kind of job that is a first job. And a lot of people didn't have the opportunity to do that. And what seems to happen is once people start working in a job, sometimes what will happen, they'll say, you know what, yeah, it's a job, but I want to 7-Eleven doing all the inventory, mostly graveyard shifts, and primarily full-time. And he hated it. He just hated it. But he liked it because he made money, and it helped him. He used alcohol less because he had to be at work at a certain time. But what happened after about 1.5 years is he decided to go back to school. And I believe now is doing training in substance abuse counseling. So those things happen as well. What the important thing is not to freeze someone in time. Because what that person is dealing with right now is not how they're going to be forever, as we would with anybody, any of us. That people move on, things change, and so forth. Okay, active addictions issue. All right, I think we spoke about that a bit earlier, but it's a really important question, Tim. And first and foremost is having a very frank discussion with the individual you're supporting with an active addictions issue. Not sure if you're familiar with motivational interviewing techniques, but we have found here that those techniques help with working through their issues. If someone, and it also depends on the type of work that they're applying for. I think that would take that would be a really good further discussion to talk with people who are actively using and working. It's been my experience that the people are most inspired by hearing people who have had those issues occur and then go on to work. So Tim, I don't know if that's really helpful to you, but that's the best answer I can give at this particular time.
Okay, thank you so much, Catherine. We'll just turn it over to Regina to close today, and talking to everybody again shortly.
So just want to say a moment to thank everybody for spending the time with us. We had 91 people on the line today, so we're thrilled. Want to say thanks to Catherine. This was, I think, a really good closure session. What I thought is that it really helped weave a number of different ideas that we've talked about over the 6 sessions. We talked about things such as job developers. You will, if you haven't met them before, if you please go on the website, you'll see our archive session. So dear Chris Arnold spoke extensively about some of the other issues you spoke about. What I'm really impressed with, Catherine, is the way you spoke about different interventions meeting different needs. And I think if we look at Psychiatric Best Practices, the latest edition from NEMAC and Furlong, what we really learn is that we've been doing this kind of work for about 30 years. And in that 30 years, we've grown. And they particularly talk about a first-generation program, second-generation, third-generation programs. And I think what we're talking about here today is IPS programs. One of the things I'm really pleased about, too, is that just the recognition that much of this work began with the disability movement and has resonance, and we've generated a large body of evidence within the recovery-oriented PSR work. And IPS is one of those, as you said, Catherine, most well-researched interventions nested within that research. So you gave us a really great overview today, and also I think what you gave us a really good experience of being with this information in a very client-centered, client-driven way. And as was mentioned on the comments, just helping and empowering people to follow their own dreams. The thing that I'll remember about today's session is don't freeze people in time. Catherine, that is a beautiful sentence that I'll definitely take away with and remember. Thanks to all of you who made connections, absolutely wonderful experience in the room and lots of learning. So we will be in contact with Erica, and I really thank you for taking up the call, Erica, and said, I could do this. We'd love to hear from others who have also wonderful specialized information. This is your website and your advanced practice, so let's make it happen. If you have things you want to share with us, we'd love to hear, and we will support you to make that happen. So with all of that, we thank you. We look forward to your feedback. You will get a feedback questionnaire from this session, and you will get in 2 months' time a feedback questionnaire about the entire series. So we really do need your feedback, and we appreciate it. Thank you kindly. We will be in touch. We're planning 3 new sessions, so we will be in touch and we'll advertise them. And we look forward to seeing you at the conference. Thank you kindly, and thanks again, Catherine.
That in terms of education, we do support people, say if they want to take a course in customer service relations, or if they want to take their first aid or food safe or WMIS or some of those other courses, we do help facilitate those. But someone's going on to, as I mentioned earlier, going to BCIT, for example, to do a diploma program in accounting, we would probably step out of that and let someone else work towards that goal with them. That's it.
Wonderful. Thank you so much, Catherine. Take care, all.
Thank you.
Enjoy your holiday, Catherine, as Susan said.
Take care.
Enjoy the sun.
This is my, look at my little, let's see if I can get it. There she is. Bye.
Bye.